Welcome to The Explainer. Today, we're tackling something that, well, has touched every single one of us on the planet, COVID-19.
And let's just start with a number. Over 18 million. That's the estimated number of excess deaths caused by the pandemic. A number so huge, it's almost impossible to really wrap your head around. But it's exactly why getting a clear handle on this disease is so important.
So to make sense of it all, we're going to break it down with 5 key questions. What is it? How does it spread? What's it do to us? How do we fight back? And what's its legacy? Okay, let's get into it.
All right, first things first, we've got to get the terminology straight because there's this one key distinction that a lot of people, even now, still get mixed up.
So you have SARS-CoV-2, that's the virus, and then you have COVID-19, that's the disease you get from the virus. Think of it like this. HIV is the virus, and AIDS is the disease it can cause. It's the same idea here. Getting that little detail right is really the foundation for understanding everything else.
And the disease itself? Well, it came with this whole list of symptoms that, let's be honest, we all became way too familiar with, right? You had the usual suspects like fever and a cough, but then there was that really weird, super specific one, losing your sense of taste or smell.
Okay, so that brings us to our next big question. How on earth did this thing spread so far, so fast?
Well, it really boils down to the air we breathe. It's a pretty simple 3-step process, right? An infected person breathes out, those infectious particles travel through the air, and then somebody else breathes them in. Exhale, travel, inhale.
But here's where it gets a little more technical, and this is super important. We have to talk about droplets versus aerosols. This difference is the entire reason you heard so much about ventilation and being outside. See, droplets are bigger, heavier particles. They come out, travel a short distance, and then just fall. But aerosols, they're tiny. They can just hang out, suspended in the air for a long time, especially if you're indoors. That was the real game changer.
All right, so the virus is in. Now what? What does it actually do inside your body? Well, it turns out it's a lot more complicated than most of us initially thought.
You see, everyone thinks of COVID-19 as just a lung disease, right? But that is not the whole story, not by a long shot.
It's what we call a multi-system disease. It doesn't just stick to the lungs. No, it can go after your heart, your brain, even your kidneys. And that's why we saw such a bizarre, wide range of complications in people.
And for a lot of people, just getting over the initial sickness wasn't the end of it. We started hearing about this condition called long COVID with debilitating symptoms that could just stick around for months or, in some cases, even years.
So faced with this massive global challenge, how do we fight back? What was the plan?
Well, the first line of defense was all about prevention. It was this idea of a layered strategy, combining brand new miracle tech with old school public health basics.
And look, when you see the data on vaccines, it's just stark. The numbers don't lie. Death rates for people who were vaccinated were dramatically lower than for those who weren't. It was, without a doubt, our most powerful weapon for preventing the worst outcomes.
But what about people who still got sick? Well, the treatments got a lot better over time, too. We went from just trying to manage symptoms, supportive care, to having actual antiviral drugs that could directly attack the virus and stop it in its tracks.
Okay, so for our last big question, when we look back at all this, what's the main takeaway? A huge part of its legacy is understanding who was really in the most danger.
And this table, this really says it all. This shows the infection fatality rate, which is basically your odds of dying if you get infected. And it was not the same for everyone, not even close. It shot up exponentially with age. I mean, look at this. If you were over 85, your risk was literally thousands of times higher than someone in their 20s. That huge, staggering difference is maybe the single most defining feature of the whole pandemic.
So the emergency phase might be over, but the virus is still with us. And that leaves us with one last, really big question to chew on. We've all lived through this defining global event. So, what did we learn from it? And how does that prepare us for whatever might be coming next?